Welcome. My name is John Flett. I'm a pediatrician who is passionate about helping parents, families, children who think differently. Today I'm going to be talking about the approach of winter. We're in early autumn and children are getting sick. And every day I chat to parents and talk about, is your child getting too many infections? At what point do you start worrying about allergies, a weak immune system? Is your child just in creche and having crashitis? Remember tonsillitis? And how about crashitis? Is it just a matter of having too many infections at certain times of the year? With COVID over the last 2 years, children have been avoiding having their immune systems developed. We've been sanitizing, removing viruses. We know how to remove viruses. And now children are back socializing, parents are socializing, parents are in contact with other kids, play dates, back at school in full force. So it's the time of the year when you're wondering whether your child will ever get healthy again. They're constantly being bombarded by all these colds and flu. They get sick over and over again. And at what time do you start to worry that these infections are too many? So how many colds per year is normal for a child? You know, children start to get sick after the age of about 6 months. That's when their mother's antibodies have kind of reached their sell-by date. And also they've got to start developing their own immune system. And at what point does a child start to need to develop their own immune system? Well, it's between 4 and 6 months. And they have to build up. And these children seem to always start sniffling, particularly if they've got an older brother and sister. A second sibling tends to be sicker than the first because they've got an older brother or sister that's making them sick. You know, they get one cold after another. And many parents wonder, isn't my child having too many colds? So is there something wrong with the immune system? That's a common concern. Babies, toddlers, preschoolers get about 7 to 8 colds a year, and that's normal. And during the school age, they have about 6 colds. And finally, when you get to the teenage years and adult years, you have about 4 colds a year. Probably more if you've got a older sibling or you've got children. So if you've got young children, you're probably more likely to get sick. In addition to the colds, children get lovely diarrhea illnesses, and with or without vomiting, 2 to 3 times a year. Each child gets high fevers, and most of their colds have a kind of a sensitivity. They get sensitive tummies and sometimes get colds and tummy problems together. So why do children keep getting colds? You know, one of the reasons is that they're exposed to new viruses. When you go to school, you get bonus material. You get your brain educated, you get your development aided, but you also get your immune system educated at the same time. And they're everywhere. We know how sensitive to viruses. You know, children during COVID, thank goodness, didn't get the COVID in the same way adults did. And adults, of course, we have got that immune system. We've had all those colds and flu when we were children. Now, children have to go through the same process. Colds are more common in large families as the viruses go around the house. So the more social you are, the more people you come into contact with, the more likely you are to pick up colds. So the rates of colds triples during winter. Not because, cold air, a lot of people think, particularly, I was always told as a child, you mustn't go outside, you must put your jersey on, you mustn't go outside when you've got wet hair, you mustn't sit in a draft, you mustn't have cold wind, putting your feet on cold tiles will make you sick. And I'm afraid none of those are really true. It really is a matter of crowding. People are indoors, particularly in Northern Hemisphere climates where everybody's indoors. So the more outdoors you are, the less colds you're going to get. And you breathe in this recirculated air from everybody. Anybody who smokes in the house will hugely increase the chance of the child developing colds and flu. irritates the airways and makes children more susceptible. So one of the things that often I get asked, is it an allergy? A lot of adults will say, I'm not sick, I've just got sinus. And what they really mean is they've got an allergy. And that's not always the case. So allergies are certainly possible, particularly in families where there's a family history of it. But allergies are more accessible to be treated than colds because medication can control these symptoms. So it's useful sometimes to know the difference. If your child is over 2, sneezes a lot, rubs their nose a lot, and all the time, and has a clear runny nose and lasts for about a month and doesn't have a fever, your child certainly could have allergies. And it's especially true at certain times of the year with the pollen seasons, meaning that spring and kind of autumn, that's this time of year, possibly could be the case. And it depends on what the allergy is. Is it something that you're breathing in or something that you're eating? Most likely you'd have picked up whether your child's allergic to something they're eating early on. It's not always dairy. Everybody blames dairy, for that. You would know that that was the case when your child was introduced to formula milk or other things like yogurt and cheese and so forth. So these are things that you should discuss with your doctor, and a pediatrician is well kind of placed to make that diagnosis. We see children for a living. That's all we do. Parents often wonder if their child is getting sick because of a lack of vitamin. And because it's cold outside, they want to rush off to the pharmacy and get all those vitamins. Colds are not caused by a poor diet. They're not caused by a lack of vitamins. They're not caused by bad weather, air conditioning, wet feet or hair, or playing outside without a jersey. Having colds are an unavoidable part of growing up. Colds can't be really prevented, no matter what you see on TV or read on the internet. They build up your child's immune system. So, if your child is getting a lot of ear infections, it doesn't mean to say that your child has a severe health problem. It means that the tubes called the eustachian tubes, they're not draining properly. And some people genetically are just very susceptible to those. And if your child is having repeated ear problems, that's when you need to kind of make sure that you get referred on to somebody who understands those issues. And if a child's having recurrent ear infections, not clearing up with medication, those are the children that need to be seen by ears, nose and throat specialists, because it can stop development, speech, and we all know that's not such a great thing. And also other parents worry that there's some underlying disease that is a result of lots of colds. A child with a weak immune system doesn't get necessarily, just colds. They get more severe infections, go straight to their chests. They get it very severely. And the difference is that a child with an immune problem will have trouble recovering from the illness. They take much longer to get better. They don't just get sick and get better quickly. They take a long time. They often need to be in hospital. And as a result, that is when we need to do tests on them. And there are, children have these problems, often have other types of problems. They get pneumonia, they get boils, they get eye infection, skin infections, chronic upset tummies that make them not gain weight and look unwell and lose weight. So how can you take care of your child when they get these viruses? First of all, look at your child's general health. If your child is vigorous, gaining weight, you don't need to be as worried. If your child's not sicker than the rest of those kids, communicate. A lot of parents they're not always honest about how sick their child is and whether they're getting as many infections. Children get over colds by themselves. Although we can reduce those symptoms and shorten those sort of periods with symptomatic treatment, there's not a huge amount of medication that will really kind of cure them. Cough and colds medicines, particularly in young children, can cause problems, can cause them to eat poorly, lose their appetite, not sleep correctly, cause irritation, cerebral irritation. Be very careful of over-the-counter medications. You know, the number of colds will decrease over the years as your child gets kind of these infections. You almost got to think about it. You can kind of tick off the problems that your child's getting because they're going to get less. And unfortunately, this time of the year, in the wintry time, it gets squashed together, concertinaed. It's almost as though children get so many infections and it feels like one leads into another. Just think about your child's incubating lots of different colds at the same time. So they get over one, and as they're getting over that one, they get another one, and they get another one. Then parents think, well, my child's been sick for 3 weeks. You know, it's the same cold that lasted 1 month. It's unlikely to be the case. It's just that they're kind of getting over one, getting another, getting over one, getting over another. The so-called creche syndrome. These are things to think about, and maybe take your child out, let them recover before they get back to school. So when should you send your child back to school after a cold? You know, children at schools, the schools are going to be careful. They've got to kind of make sure that infections don't cause other problems. Sometimes parents who are working, they're under pressure because they've got to send their child back to school. They're worried about their own jobs. They don't have leave. They don't necessarily have parents' responsibility leave left. So there's huge pressure to send their child back to school, even when they're on antibiotics, which is not so good. You know, so parents have got to think, you know, you've got to make sure that your child is well and have, you know, consideration for other parents. Because those kids that get back to school, they're going to just infect, and it's like a vicious cycle. Sometimes you've got to take your child out, allow the immune system to recover. And I mean, some colds can last 3 weeks, depending on what the problem, specifically with this RSV virus. It is absolutely a pandemic at the moment. So every child throughout the world, I've been reading about articles elsewhere in the world, children are getting sick everywhere. It's not just your child. So these are things that you think that are causing a problem. Some children who have chestiness, underlying asthma or tendency towards asthma, they're more likely to pick up these colds and trigger their chest, and it takes much longer to get better. And of course, that leaking nose, that postnasal drip, that incessant coughing causes lots of disturbing, not sleeping well, irritability, you know, making sure your child's well hydrated. Give them something to bring the temperature down. Take away those horrible achy, headachy, body aches and pain feel. If your child's eating reasonably well, drinking reasonably well, then you know you're on the right road. Your child doesn't necessarily need an antibiotic for these problems. So these are things that you think that are a problem. Please get into contact with me. There's so many different things that we've got to approach. Remember, pediatricians, we're not going to be aggressive about treating with antibiotics. And I hope that helps, and we'll talk soon.